Welcome to our Proposal 3 presentation. We're glad that you joined us. We are going to be diving into Proposal 3, finding out what it's all about, and we're going to examine the question, should we vote yes or no on Proposal 3? Next slide, please. So you may have seen these signs around town in Kalamazoo and all across Michigan, wherever you're at. And I wanted to bring our attention to the yes on Proposal 3 sign. I wanted to make it clear, based on these signs, what the objective is of Proposal 3, according to those who have put it forward. On the sign it says, restore Roe, and it also says, stop the 1931 law that would ban abortion in Michigan. And so these are the two intents on those who are putting forth Proposal 3. And as we're going to find out in our presentation, this is not the entire truth. There's a lot more that's being pushed with the wording that's contained in Proposal 3. And my name is Micah Hasenberg, and with me is Rob Carrer, and he is with Right to Life, and he's going to help us to discover really what is in Proposal 3 and what the wording of Proposal 3 can tell us about the true intent of some of what Proposal 3 is all about. And without any further ado, here is Rob Carr from Right to Life. Thanks, Rob, for joining me.
Thank you, Micah. I want to thank Kalamazoo Free Methodist Church for hosting this event and other churches that might be involved in this live feed. The official symbol banner of our coalition is called Vote No on 3. It is too confusing and too extreme. And hopefully you've seen signs like that all over the state. But before we really get into this, we have, you've received a copy of this as you came in. This is the 100-word summary that you will discover when you go into the polling booth to vote on November 8th. And what's confusing about that is that it is not the full truth, because what is not being told by this document is that there's a 321-word proposed constitutional amendment that will go into the Michigan Constitution if Prop 3 passes. And the wording on the proposed amendment is not at all like this summary that you're going to be seeing when you vote. So we're going to kind of go through, primarily we're going to be going through the proposed amendment as opposed to the ballot proposal.
Yeah, so I can see here, Rob, that the actual voting document is only 95 words.
Right.
Which doesn't include all of the rest of the words that are in the amendment.
Right. Let's just kind of temporarily or briefly go through the 100-word summary. And, like I've said this before, that, it's concealing the truth. It's kind of like an onion. You peel an onion and, you continue to peel, and pretty soon you've got nothing left of the onion. But then you're saying, so where is it? And it's not there. And that's kind of how this summary is. You keep trying to discover what the truth is, but you get to the end, you get to the last line, and you find out, I haven't learned anything. I really haven't learned anything because it's too confusing. It's too concealing. There's a certain amount of deception in the 100-word summary compared to the actual proposed constitutional amendment. So we're going to go through the proposed amendment. So let's change slides here. Okay. The first portion of the proposed amendment, not what's on your ballot, but the amendment, says, every individual has a fundamental right to reproductive freedom, which entails the right to make and effectuate decisions about all matters relating to pregnancy, including, but not limited to, prenatal care, childbirth, postpartum care, contraception, sterilization, abortion care, miscarriage management, and infertility care. And the first ones and the last two are fine. We have no problems with prenatal care, childbirth, postpartum care, infertility, miscarriage, but it's the middle ones that we have problems with, and we're going to be discussing those. But right from the start, you see where it says every individual, and that tells you right off the bat that this proposal will grant these reproductive rights to adults and minors. Because if they had wanted to say this is for adults, the wording would have said adult, but it says individual. So it's broad, minors, adults, and if it includes minors, now comes the issue of where are the parents involved in the decision making? Where is parental consent? Or even notification? It does not exist based on how those first two words define every individual. And that's a concern to me, and hopefully it's going to be a concern to the voters in Michigan, because parental consent is no longer really a part of the equation. Okay, now there's another part that says that it's all matters relating to pregnancy, but not limited to. So there may be some more things in here that a future judge is going to look at this and say, well, you know, there are more issues involved in all matters relating to pregnancy than just those 8.
Right.
So, you know, if the pro-abortion advocates cherry pick and they find a liberal judge, a pro-abortion judge, he's going to possibly find more things in here that are now listed. And then there's another issue where it says here, this kind of goes into the issue of parental consent. It says that the individual, so it's a minor or adult, has the right to make decisions about all matters relating to pregnancy. Well, if a minor can make a decision, then all of a sudden, where is the decision-making of the parent? It's gone. So right in the beginning, we can see here that parental consent has been completely removed from this equation. And Prop 3, it makes Prop 3 very dangerous and very threatening to the parents in the state of Michigan. Okay. I'm going to hand this off to you.
Okay.
To Micah Hasenberg, who's going to talk about another one of those 8 categories that's on the screen.
Yes, we're going to dive into one specific category of the all matters related to pregnancy, but not limited to, right? That term that Rob just explained is this vague umbrella term. But one specific term I'd like to talk to you about is the sterilization part. And so we know that Proposition 3 has been proposed by Planned Parenthood with partnering with the ACLU. And the ACLU right now is pushing transsexual rights, and they're really advocating for the transsexual individuals. And with that said, sterilization is actually referring to the right of an individual to remove their reproductive organs. For example, a woman who has the desire to become a man and is a transsexual at that point, their right to remove their womb and have a hysterectomy and to have a mastectomy would fall under the category of sterilization. Because when when a transsexual, in their mind, they view the right to sterilization as a reproductive right. And it's not a conspiracy theory. This is something that is actually being pushed by Planned Parenthood. And it's not only in regards to adults, which is one thing, it's also in regards to children and teens. And so based on Rob's explanation of the term individual, we've already found that's referring to both adults and minors. But the term individual not only refers to females, individual is all-encompassing, so it refers to boys, men, girls, and women. And so this sterilization, the right to sterilization, is referring to the process of which a girl, for example, would undergo to become a boy. And Planned Parenthood is facilitating this process by offering hormone blockers and by offering psychological evaluations for children, because those are the two qualifications needed to undergo gender-affirming surgery. And this whole process falls under the term gender-affirming care, which really is a euphemism because it's not really gender-affirming. It's the opposite. It's affirming their gender identity. Affirming their gender would be affirming their biological sex. But affirming their gender identity is really a more accurate definition of what gender-affirming care is referring to. And in Michigan, Planned Parenthood has already opened 12 gender-affirming care clinics where children can go to receive hormone blockers and get on this process of transitioning from one sex to the other, although not in reality, it's a medical transition. Their biological sex still remains the same, but they present as a different gender using medicine and ultimately through surgery and by surgical removal of sex organs, to make them appear more like the other gender. And without any further ado, I have a video here that's an advertisement of what Planned Parenthood is promoting in Michigan. And I'd like to share that video with everybody watching this presentation, just as more further proof for you to see with your own eyes what Planned Parenthood's perspective is on gender and on the youth and their ability to transition.
There's no one-size-fits-all puberty experience. If you're trans, intersex, or non-binary, know that you're not the only one feeling confused. For some intersex people, puberty may start
And I'm
later
just
than
making
age
sure
14.
that we can hear the volume.
You might experience some of
Okay,
puberty's
great.
changes and not others, and your body may or may not go through puberty on its own. There are medicines you can take to help your body start the process, like hormone replacement therapy. Some people decide on hormones or surgeries to help their bodies match up to their gender identity, or how they feel inside about themselves. Your gender identity is real. You should be the one to decide what changes you want to make to your body. If you're transgender or non-binary, you may find that your puberty experiences don't line up with your gender identity or how you see yourself. That feeling can be uncomfortable, scary, and stressful. If that sounds like you, know that you're not alone. There are medicines you can take to delay puberty for a while. They're called puberty blockers, and they work like a stop sign by halting the hormones testosterone and estrogen that cause puberty changes like facial hair growth and periods. Puberty blockers are safe and can give you more time to figure out what feels right for you, your body, and your gender identity. You don't have to have all of the answers right now. So remember, it's all a work in progress, and it may take time to figure out what feels right to you, but talking to a trusted adult and a nurse or doctor may help. Want to learn more? Go to PlannedParenthood.org/teens.
Okay. And so as you could see in the video, Planned Parenthood is not only pushing abortion, but they're also pushing medicine and hormone blockers to prohibit the teen from entering into puberty. And they describe this process as a stop sign. And they describe this process as something that is something that you can just totally reverse. And I just want to be clear with everybody that this is deceptive, and hormone blockers long-term do have negative side effects on children, negative consequences. And that's something that I encourage everybody watching to look into. I don't have time to go into all of the effects of all the medicines that they're promoting on children through Planned Parenthood. But the reason why coming back to Proposal 3, this is so important is because it would be the child's individual right to decide to go on those hormone blockers. And as an example, if the child went to school and was exposed to gender ideology and these ideas that they can become a different gender during that most vulnerable phase of puberty, which is what Planned Parenthood is advertising, it's about puberty. When they're in that most vulnerable phase, they could hear about gender ideology and then they could go to their teacher or their school counselor, and their school counselor could say, oh yeah, well maybe you are confused and your gender identity is different than what your actual biological sex is, and let me tell you about Planned Parenthood, and let me take you to Planned Parenthood. And in fact, if Proposal 3 is passed, there's nothing that the parent could do to have any sort of repercussion against that teacher or school counselor. In fact, the student would be able to get on those hormone medicines and those hormone blockers without parental consent and without their authorization. It's just totally up to the individual right, which, as we already discovered, includes minors as well. And so without going into any farther, I'm going to pass it back to Rob.
Okay. Thanks, Micah.
To continue us on going through the wording of Proposal 3.
And you thought Prop 3 was just about abortion. That's what the other side is selling. It's all about abortion. We had Roe for 50 years. We lost Roe by that evil Supreme Court, and we just want Roe back. That's all we want.
We just want Roe.
And this whole issue of transgender sex changes and all that has nothing to do with Roe v. Wade, but it's in Prop 3.
Mm-hmm.
Okay. The next on the list is abortion care. And I'll be honest with you, I hate the word care connected with the word abortion, because that's not care. To me, exploitation is more like it, because you're exploiting a vulnerable woman she has an unplanned pregnancy, and rather than give her wise counsel, you're selling abortion, and that's horrible. It dehumanizes society, and it pits the mother against the child. It's an either-or formula. So, and like the pro-life movement has said for a long time, why can't we love them both? Has this right to reproductive freedom, it cannot be denied unless justified by a compelling state interest achieved by the least restrictive means. I'm sorry. The next slide. I forgive. It sounded like there was there we go. An individual's right to reproductive freedom shall not be denied, burdened, nor infringed upon unless justified by a compelling state interest achieved by the least restrictive means. And I was intending to say, what does the least restrictive means mean? What does that mean?
What does that mean?
In 1992, the Supreme Court Justice Sandra Day O'Connor helped write Planned Parenthood versus Casey. She scrapped the trimester framework established in Roe and replaced it with a new standard, the undue burden standard. A state could enact a law restricting abortion provided that it did not impose an undue burden on a woman's right to get an abortion. Here in Prop 3, the legislature can draft a law as long as it is the least restrictive. Again, I ask, what does that mean? How weak does that law have to be to qualify as the least restrictive? And what's the purpose of a law if it has no teeth to impose any restriction, however mild, on abortion? In short, this portion guarantees that under Prop 3, there will be no restrictions and no regulations on abortion, period, none. Next slide, please. Okay. Notwithstanding the above, the state may regulate the provision of abortion care after fetal viability, provided that in no circumstance shall the state prohibit an abortion that, in the professional judgment of an attending healthcare professional, is medically indicated to protect the life or physical or mental health of the pregnant individual. This part deals with fetal viability. The amendment states that the state may regulate abortion, but only after viability. And I've argued many times that viability is an arbitrary benchmark. What is pregnancy but a 40-week timeline continuum from conception to natural birth? So the question is, when does life begin? Any point you pick along that line is arbitrary. Should we play with the lives of unborn babies based on an unreliable marker like viability? Especially since that line called viability keeps moving. Back when Roe was first decided, viability was around 28 weeks. Well, now with advances in modern medicine and neonatology, viability is now 24, 23, 22 weeks. As things improve, as medicine improves, the viability, the age of viability is lowered. But according to the proposed amendment, the state cannot even interfere in abortion beyond viability for reasons of physical or mental health.
Wow.
And so health is a broad term the Supreme Court has already defined as including emotional, psychological, or the woman's age. Abortion beyond viability takes us into dangerous waters. How far past viability? Into the 7th month? The 8th month? It is unclear. The text says beyond viability for reasons of health. In short, Proposal 3 will guarantee that late-term abortions, however rare, will be legal in Michigan. In the last part of this section identifies the person who can perform the abortion, a healthcare professional. So that begs the question, who is a healthcare professional? A physician, an OBGYN? Anybody else? How about a chiropractor, a social worker, a family therapist, a dentist, a veterinarian, to name a few? If the pro-abortion authors of this amendment intended it to mean physician, then why didn't they use the word physician? That's a big question. Even in Roe v. Wade, the author of the Roe decision, Harry Blackman, said that the woman must be in consultation with her, quote, attending physician, unquote. So even in Roe, the person performing the abortion had to be a physician, but not in Prop 3. In Prop 3, it could be a social worker. This is way more extreme and far more dangerous than anything stipulated in Roe v. Wade. This is one of the most glaring and confusing portions of Prop 3. Think of the possible abuses and dangers to women if a non-physician could perform abortions in Michigan. But it could happen in Prop 3. Next slide. The state shall not penalize, prosecute, or otherwise take adverse action against an individual based on their actual, potential, perceived, or alleged pregnancy outcomes, including, but not limited to, there's that not limited to again, miscarriage, stillbirth, or abortion, nor shall the state penalize, prosecute, or otherwise take adverse against someone for aiding or assisting a pregnant individual in exercising their right to reproductive freedom with their voluntary consent. So this is dangerous. The first part of this is not on the 100-word summary on the ballot. The state cannot punish an individual based on pregnancy outcomes, including, but not limited to, there's that term again. I mean, I know I bring it up more than once here, but when you throw in that and not limited to, you've opened up the door for more possibilities.
And interpretation.
And interpretations. It's not just miscarriage, stillbirth, and abortion. So what are pregnancy outcomes? Well, birth is a pregnancy outcome. Abortion is a pregnancy outcome, as are miscarriages and stillbirths. But here's another possibility, another scenario, rare perhaps, but possible. Suppose a 16-year-old girl is pregnant, does not intend to have an abortion, but is scared and living in denial. She does not know what she intends to do when the baby comes. She's also hiding her pregnancy from her parents. Maybe she's a little overweight, and her parents just think she's putting on some extra pounds. What if she goes into labor, say 7 months or 30 weeks? She delivers her baby all alone, not at home or at a hospital. And what if she panics and decides to hide the fact of her pregnancy and her baby by tossing that newborn into a dumpster? And what if the baby dies from neglect and exposure? This has now become infanticide, a live birth and a dead baby. Normally, police would get involved, for this is a crime. But is tossing her baby in the dumpster her pregnancy outcome? If she is discovered, can she be prosecuted, at least to some extent, for killing her baby? The text states that she cannot be punished because this was her pregnancy outcome. Can the police even be allowed to investigate? Hey, we just legalized infanticide. Proposal 3 is too vague and too confusing to give us a clear answer. Let me give you another possible scenario, more probable perhaps. Take that same 16-year-old high school student. She can get an abortion without her parents' consent or even knowledge. She doesn't even need a judicial waiver. She can do whatever she wants because she is an individual. Let's look at the next portion of the proposed amendment here. It says, this is just as bad. The state cannot punish someone for helping another person from exercising their reproductive freedom.
Wow.
So let's examine this.
Yeah.
Same 16-year-old student. Her guidance counselor, her teacher, or a neighbor perhaps could drive her to Planned Parenthood to get that abortion behind the parents' backs. Can you name one other medical procedure or test or drug that could be given to a minor without parental consent? A school cannot administer an aspirin to a minor without parental consent. But we can allow a teacher to take her to get an abortion and the parents have no recourse? That is insanity. And the text of the amendment states that the teacher or counselor cannot be prosecuted for helping that teenager get her abortion behind her parents' backs.
Yeah, and exploring that idea a little bit further, like you might say, well, why would a school counselor ever tell a student to get an abortion? Well, they could say something along the lines of, you're not going to be able to go to college.
Oh, there's a whole slew of things they could say.
If you don't get an abortion, and so on and so forth.
Yeah. And most likely, if the teacher or the counselor or the principal is going to take them to Planned Parenthood, they obviously are already sympathetic to the whole idea of legal abortion.
Mm-hmm.
I mean, rather than take her to a crisis pregnancy center where there could be counseled to talk about life for that baby or for adoption or whatever, they tunnel that girl right into the arms of Planned Parenthood or an abortion provider. Let me give you another possible scenario. This is also rare, but it could happen. A 13-year-old girl was raped by a close relative. He talks her into allowing him to drive her to Planned Parenthood. The girl's abortion is her pregnancy outcome. Based on how the amendment is worded, the rapist cannot be prosecuted for helping her get the abortion. But can he be prosecuted for the rape? I do not know. The wording is very, very vague. It's just very vague. But the abortionist has just removed the evidence of the crime. Next slide. A state interest is compelling only if it is for the limited purpose of protecting the health of an individual seeking care, consistent with accepted clinical standards of practice and evidence-based medicine, and does not infringe on that individual's autonomous decision-making. So here the state can enact a law only if it is compelling and only for the limited purpose of protecting the life of the individual, not the life of the baby. It only protects the health of the individual. So if a baby survives an abortion, can the state enact a law to protect the baby, to require the clinic or the hospital to begin treatments to save the life of the child? The text is unclear and confusing. If not, will the baby be allowed to die by neglect in some hospital or clinic closet? Next slide. Fetal viability means the point in pregnancy when, in the professional judgment of an attending healthcare professional, and based on the particular facts of the case, there is a significant likelihood of the fetus's sustained survival outside of the uterus without the application of extraordinary medical measures. Here's more discussion on fetal viability. Again, we see the term attending healthcare professional, not a physician, not an OBGYN. So we've already talked about how that is extremely dangerous for Michigan's women. But it talks about the fetus's sustained survival outside the uterus without the application of extraordinary medical measures. So that begs the question, what is an extraordinary medical measure? What may be extraordinary in 2022 may be routine in 2032. Will the law accommodate the advancements in medical technology? Will an infant born prematurely be denied intensive medical treatment because the healthcare professional believes the child to be non-viable? How many babies in Bronson's NIC unit would suddenly be disqualified because the doctors are using extraordinary medical measures to keep the baby alive? The wording is unclear. And the term, the fetus's sustained survival. How much survival are we talking about? The word sustained seems to imply that newborns must survive until they're at least discharged from the hospital. Depending on the weight of the baby and other medical factors, that could be several months. If the baby will live only 5 or 6 days or a week or maybe a month, well, it's not worth employing extraordinary measures. A short life would indicate that it was a life not worth saving. But are we not all created in the image of God? All lives have value, even those that tragically end too soon. And how does the, quote, healthcare professional, unquote, know with certainty the physical constitution of that pre-viable baby? Some babies born at 21 weeks may have that inner strength, something, a fight within them, a will to live that maybe a 23-week-old child doesn't have. I believe that the term fetus's sustained survival neglects the unique capability of the individual child. This one-size-fits-all approach is not scientific and requires the doctor, the healthcare professional, you're a veterinarian, to act as judge, jury, and executioner over the life of the baby. Next slide. This section shall be self-executing. Any provision of this section held invalid shall be severable from the remaining portions of this section. Now, I'll be the first to admit that doesn't make a whole lot of sense to me. You know, the other portions are a little bit more understandable. But this legalese here at the end is confusing. But what it basically says is, if there is a law in conflict with this proposal, that it will be deemed invalid. It'll be severable from the remaining portions. You know, if you're going to sever something, you're going to chop it off. So what kinds of things might be chopped off and invalidated if Proposal 3 passes? The abortion ban of 1931, our law that prohibits abortions throughout all 9 months of pregnancy, except to save the physical life of the mother. Our ban these are things we would lose. Our ban on partial birth abortion, a procedure birthed in hell, so barbaric that it defies comprehension that any civilized nation would permit such a cruel, wicked, and evil method to kill a baby just inches from birth. Our ban on state-funded abortions. Taxpayers would have to foot the bill for abortions through the Medicaid program. Our parental consent law, and we've talked about that already. Parents would be written out of the abortion conversation. Our 24-hour waiting period law, just making a woman think, just to think hard about what they're planning to do. And some women, when they're thinking deeply about the consequences of this decision, some women change their minds and they choose life for their babies. But if Prop 3 passes, this provision would probably be removed. Our law requiring that the woman be given the option of viewing an ultrasound of her developing baby. And here again, this is kind of like the previous one. Some women, it's just an option. They're not forced to see the ultrasound. But if the woman opts to see an ultrasound and she sees that baby on that screen, she sees the humanity of that child. There's a good chance that that woman will choose life for her child if she has the option to see that ultrasound. This would be removed if Proposal 3 passes. Our informed consent law. How safe is it for Michigan's women to know that the health care professional aborting her baby will not be required to inform her of the medical procedure or tell her the risks of the abortion? Now, here's a quote here from Chief Justice Warren Burger. I'm dating myself a little bit. And he said this in a dissent of a 1986 abortion-related decision. Quote, this is from 1986. Can anyone doubt that the state could impose a similar requirement with respect to other medical procedures? Can anyone doubt that doctors routinely give similar information concerning risks in countless procedures having far less impact on life and health, both physical and emotional, than an abortion, and risk a malpractice lawsuit if they fail to do so, unquote. With Proposal 3, our informed consent law would be invalidated. Next, our law protecting the conscience rights of hospitals and doctors who decline to participate in abortion. Our Coercive Abortion Prevention Act. That we have a law now that says that the boyfriend cannot force his girlfriend to get an abortion. He can't force her. It would have to be her decision. Well, with that law would be gone. And who knows what could happen with a boyfriend. Our abortion insurance opt-out law, because that was part of Obamacare, that abortion would be part of health care. And our law said that it would not be. We could opt out of that provision. Our clinic licensing law. How safe will it be for Michigan's women knowing that their abortion clinic may not be inspected for decades by health and safety officials? And the list goes on.
So before you finish, Rob, it seems like the goal, according to these signs, is to just abolish that 1931 law on the books. However, it abolishes way more laws.
Way more, and you hear, and I've even heard Governor Whitmer say that what we are describing, these possibilities, that we are just fear-mongering, and this is not true. Parental consent will not be eliminated, and these regulations will not be eliminated. But to me, words matter. Words have meanings, and if things are are written in such a way that there is such confusion and lack of clarity, this is going to be decided by a judge.
Yeah.
And Whitmer can say, well, it doesn't include this and it doesn't include that. Well, a judge may come down the road 2, 3, 4, 10 years later and say, well, no, the wording here is very vague and it's broad, and it would include these things. So, I'm just very concerned that the vagueness of the wording on Proposal 3 opens up a Pandora's box for a whole lot of abuses, way beyond just the 1931 law.
Right.
We lose all of our protections, all of our regulations and rules. We have sterilization is now there with puberty blockers. There's so many things that could happen if Prop 3 passes and takes effect in our Michigan Constitution. And if it's part of it, it's not just an amendment. It's part of our state constitution, and it's practically impossible to remove part of a constitution. I think you need like either 3/5 or 2/3 of a vote to remove it, and that's really difficult to get, especially in this kind of climate, political climate, to get these things removed. Once that's in there, it's in, and judges will just be making decisions based on the vagueness of the terminology. And we cannot let that happen. We cannot let this thing pass. To wrap up, about a week ago, I heard this on, I guess it was on YouTube, that a Right to Life in Michigan staffer said, it was on Fox News, that's who it was, read my notes, that Prop 3 is like a Trojan horse. And I said to myself, boy, did she nail it. And I wish I had thought of that before she did. But it is so true. So I just wanted to just mention briefly the story of the Trojan horse, because I think we've all heard the term, but what actually was it? Well, this is myth, okay? It's not a true story, but it's a legend from Greek mythology that Troy was a city in present-day Turkey, and the Greeks were attacking Troy, but they were losing. But they had a plan. They left. They pretended to flee, to abandon, but they left this wooden horse, this large wooden horse, outside the city gates of Troy. So the Greek army fled, and the Trojans said, "Oh, look at this, the spoils of war." So they dragged the horse into the city of Troy to celebrate this great victory. Well, that evening, the Greek soldiers inside the Trojan horse crept out of that out of that big horse, and opened up the gates of Troy, and led in the Greek army that really had not abandoned, had not fled. So they charged in and they defeated the Trojans. They burned the city, and it was a great victory. But what the point here is that Proposal 3 is presented to us with all these bells and whistles that it's just going to bring Roe v. Wade back. That's all it's going to do. And the Michigan voters will let this thing in, and then in the cloak of night, I like to say, the enemy comes in, and all of a sudden we have lost everything. Parents have no rights anymore. Non-physicians can do abortions. Right down the line, parental notification, consent, informed consent, all these things that we have passed, we could lose, and we cannot let that happen. We must defeat Proposal 3, because if we don't defeat it and this thing passes, it's locked into our state constitution, and we're going to suffer the consequences of abortion on demand, transgender rights. A lot of things will happen if this thing passes. With that, I want to thank you all for participating in
Yes.
this program.
Yes, thank you. And to close our presentation, I'd like to read Psalm 139. O Lord, you have searched me and you know me. You know when I sit and when I rise. You perceive my thoughts from afar. You discern my going out and my lying down. You are familiar with all my ways. Before a word is on my tongue, you know it completely, O Lord. You hem me in, behind and before. You have laid your hand upon me. Such knowledge is too wonderful for me, too lofty for me to attain. Where can I go from your spirit? Where can I flee from your presence? If I go up to the heavens, you are there. If I make my bed in the depths, you are there. If I rise on the wings of dawn, if I settle on the far side of the sea, even there your hand will guide me. Your right hand will hold me fast. If I say, surely the darkness will hide me and the light become night around me, even the darkness will not be dark to you. For the night will shine like day, for darkness is a light to you. For you created my inmost being. You knit me together in my mother's womb. I praise you because I am fearfully and wonderfully made. Your works are wonderful. I know that full well. My frame is not hidden from you. And when I was made in the secret place, when I was woven together in the depths of the earth, your eyes saw my unformed body. All the days ordained for me were written in your book before one of them came to be. How precious to me are your thoughts, O God. How vast is the sum of them. Were I to count them, they would outnumber the grains of sand. When I awake, I am still with you. If only you would slay the wicked, O God. Away from me, you bloodthirsty men. They speak of you with evil intent. Your adversaries misuse your name. Do I not hate those who hate you, O Lord, and abhor those who rise up against you? I have nothing but hatred for them. I count them as my enemies. Search me, O God, and know my heart. Test me and know my anxious thoughts. See if there is any offensive way in me, and lead me in the way everlasting. Thank you. Thank you for joining us for this presentation. And please vote no on Proposal 3.